And again, if I'm doing body parts and I'm working, if someone's coming in complaining of arch pain or side of the foot pain, I'm going to go right to the foot attachments. So I'm going to find my navicular bone right there. So here's where I'm going to start. So as I'm working, I would use thumbs initially, and probably advance to double thumbs. And there's the navicular right there. Now I'm going to go to the cuneiform right there and use double thumbs in there. I'm also a big fan of tools, so I'd probably start to work my tools in there because I can be more precise. I can find things, I can hold things as I'm working other areas. I can help identify areas by using my tool. And then I'm going to go up a little bit higher, maybe another thumb length into the base of the metatarsals. So I'm going to go 2, 3, and 4, and I'm going to start working to the arch here. Again, I'd start with my thumbs, maybe start with some knuckle work too, and then I would eventually work my tools in there. I'm using the L bar here into these areas. And I'm looking for the pain areas, and I'm looking to do provide pain relief there. In another video, I talk about how to do that using a pain scale. That's very effective. So then I'd work these areas. I come up and I'd start to work the tendon. So I'm going to have them press and invert. There we go. Tendon's exposed right there. Relax that. Good. So I would probably start with some cross fiber. Tendonitis, with a posterior tib tendonitis, people can be tender in this area. So I'd spend some time doing some cross fiber work. And then I'd come up along right next to the tibia here. Now, the posterior tib, I'm going to just go over to here for a second, right in the middle of the calf, the deepest muscle underneath the gastrocnemius and soleus. So I'm coming up along here. Now I want to influence this edge right here. So I'm going to come up here, and I'm going to start to work and look, again, with people with posterior tendonitis can have pain issues through here. So I'm going to work to relieve the pain through here. And again, I'm pressing in this way, I'm pressing in, and I might press a little bit down, like towards the bone. So I work all the way up through there. And then if I wanted to, then I would start to work the body of the muscle. So the body of the muscle is right in the middle, about up to here, 5/8, 7/8 up is the interosseous membrane. And I draw a straight line from down to the Achilles. And this is the area that I want to work. So again, I would do double thumbs, probably a knuckle thumb, working my way up until I found the tighter areas. Here there's more muscle to go through. This is going to be harder of a press. So I might even go to knuckles and thumbs together, or knuckles, fist and thumb, fist and knuckles, there we go, together. I would definitely start to try to work my tool. In this case, I just have an L bar with me and working towards influencing that interosseous membrane.